The impacts have been worse for some groups, such as seniors, workers who provide essential services, such as those in healthcare or agriculture, racialized populations, people living with disabilities, and women. The virus didn't create new inequities in our society, it exposed them.
Canada's COVID-19 pandemic hasn't cut across society evenly. A new report from the Chief Medical Officer of Health says Canada knows exactly who's feeling the pandemic most. Low-wage workers, non-unionized workers, working women, essential workers, migrant workers, and of course seniors and the people who care for them.
The fact is that the impact of COVID-19 is influenced by factors such as income, the type of work we do, how many people we live with, and if we depend on someone else for our day-to-day living.
Essential workers are most at risk, which includes first responders and healthcare workers, but also includes people working in grocery stores responsible for the food supply chain. The burden has been heavy on non-union, low-wage or hourly employees in fields where they're often unable to refuse work or minimize risk.
We understand that the individuals, often racialized, as I said, often women working in precarious work conditions, who may be single parents, are trying to essentially look after our elderly and our most vulnerable populations.
There's one area where many of these risk factors come together: long-term care homes. Those facilities account for 80% of COVID deaths to date. Prior to COVID, workers in care reported low wages and a lack of benefits, with many taking multiple jobs to make ends meet.
Overwhelmingly, women working in long-term care homes as well as nursing homes have, been on the front line and have been especially vulnerable because of their kind of gender and citizenship status. And they too have now been in work that we can consider 3D. So kind of dirty, difficult, and dangerous. And the pandemic has really exacerbated this for many of these workers.
The report, titled From Risk to Resilience, is available online and outlines some of the steps taken to address these health inequities. But Dr. Teresa Tam underlined the need to continue these efforts even after the pandemic has ended.
We need to continue to remember this moment in history, and why we need those capacities.
In Ottawa, Xiaoli Li, City News.